Good morning. My name is Aditya Nair, and my today's topic is mastectomy and its management. So, what is mastectomy? Mastectomy is the removal of the surgical procedure wherein the mastoid air cells are removed, which are the diseased part after a chronic suppurative otitis media or a mastoiditis or a cholestoma or for excess of middle ear. So, this is the particular image. There are two images. One is normal and this one is abnormal. Here you can see the mastoid process. Inside it we have the mastoid air cells. And these particular mastoid air cells, if they are affected like this, see they are affected by cholestoma, then these are removed. Okay. And now we have the classifications. Our classification is based on the surgical differences or how much part is removed. So like we have simple mastectomy, radical mastectomy, then modified radical mastectomy. So simple mastectomy often aims at draining the mastoid air cells by just posterior anterior approach, wherein it does not interrupt or disturb the particular middle ear structure or its function, so hearing loss is not present. Okay, second is radical mastectomy. Now in case of radical mastectomy, the middle ear as well as the external ear are converted into a single cavity. So in this case, it is done by lowering the wall between the mastoid as well as the external ear. Okay. In here, the inner ear is not disturbed, but the eardrum is removed. So here, hearing loss is present. Third is our modified radical mastectomy. In case of modified radical mastectomy, what happens is it's same like a radical mastectomy, but the only difference is we are not disturbing any structures. That is the mesotympanic membrane, we are not at all disturbing. So hearing loss is not present in this case. Now we have indications. Indications are acute mastoiditis. Acute mastoiditis means the inflammation of the mastoid process due to the spread of infection to the mastoid process. Then osteomyelitis, that is infection of the bone, that is especially mastoid bone as well as the middle ear. Carcinoma of the external auditory meatus as well as the middle ear. Otitis media, inflammation of the middle ear which causes serous infusion inside the middle ear and stays for a long period of time, causes plugged up feeling inside the ear, which can also cause vertigo as well as tinnitus. Then as an approach for 7th cranial nerve decompression as well as the labyrinthectomy. These complications are also based on those classifications. In case of simple mastectomy, we can see immediate bleeding as well as delayed bleeding, thrombophlebitis. Thrombophlebitis means clot formation staying inside your ear. Okay, that can also cause after the bleeding has occurred. Next is damage of surrounding structures like sigmoid sinus, facial nerve, which can cause facial nerve palsy, as these structures are staying close to the area. That's why. Then we have conductive type of deafness as well as sensory neural deafness. Conductive type of deafness as well as sensory neural deafness, which conductive type of deafness is when there is obstruction inside the ear which causes disruption in the transmission of the sound waves inside the ear due to fluid accumulation. And conductive sensory neural deafness is when the inner ear has actually damaged. Okay, that time sensory neural deafness is much more severe than conductive deafness. Then we have change in taste that causes food to seem sour or metallic, tinnitus, vertigo. Post-operative care. In case of post-operative care, we have that is after surgery what all to be done. So antibiotics are given to prevent infections, as well as if infections are present for against it, antibiotics, antihistamines, analgesics like this NSAIDs, decongestants, antiemetics to prevent vomiting, as well as our nausea, vomiting after surgery, what the patient feels, that one. The patient is instructed to avoid lifting heavy weights for 2 to 3 weeks after surgery. Also instructed to avoid traveling in flight for at least 3 weeks as it can cause increased pressure inside the ear. Hearing aid is prescribed if the patient needs it, that is in case of sensory neural deafness or conductive deafness. We have physiotherapy management. So main problems faced by the patient is pain as well as swelling. Then jaw mobility will be reduced as well as neck mobility is reduced due to immobilization after surgery. Then we have balance issues. Balance issues can be present which can cause tinnitus, vertigo, that is balance issues, balance as well as coordination. right? Also stiffness of the TM joint is also present. So to prevent them, reduce pain and swelling, improve neck and joint mobility, prevent stiffness due to prolonged immobilization, enhance balance and coordination. So we have interventions also according to them, to reduce pain as well as swelling. We have cold packs, like for 20 to 30 minutes cold packs can be given initially to reduce the pain as well as swelling. Then we have range of motion exercises, that is neck mobility, neck flexion, extension, neck rotations, then jaw opening, closing, side to side jaw movement to reduce stiffness of the TM joint, which also TM joint movements. Then we have balance training, that is vestibular rehabilitation or gaze stabilization. If balance and coordination is affected, then only. So that's it. Thank you. And references are from Principles of Physiotherapy in General Medical and Surgical Conditions by A. Tangamani Ramalingam. Thank you.